Hello everyone, welcome to LUM Special Lecture Series featuring Basic TCM and Tongue Diagnosis Made Easy, Day 8 of 12. Today we will talk about the order of observation of the tongue body color, Yang-Ming Channel Syndrome, the Yang-Ming Fu Syndrome, red points and spots. The area on the sides in the middle section of the tongue, which is around the center, reflects conditions of the stomach and spleen. If it is red, it denotes heat of the stomach and spleen. If it is swollen, it denotes spleen deficiency with dampness. If the area on the sides around the center has transversal cracks, it denotes spleen yin deficiency. So if you focus your attention on the image on the left, that is spleen deficiency with dampness because you have swelling on the sides around the center, but it's worse on the right. On the right image, you have spleen yin deficiency because you could see small transverse cracks on the sides around the center. Okay, here are more tongue images representing spleen yin deficiency. Thick, sticky yellow coating with red spots on the root indicates damp heat in the bladder, intestines, kidneys, prostate, or uterus. It is important to note that in Chinese tongue diagnosis, we do not look at the two large papillae, which are the circumvallate papillae that are right at the back of the root of the tongue. They have no clinical significance. If we see those two papillae, we are looking too far back. The normal tongue is pale red. It is pale because the stomach fluids flowing up to the tongue make it pale. It is red for two reasons. One, because heart blood makes it red, and the tongue is an offshoot of the heart. Number two, because the Minister fire flows up to the tongue, making it red. Therefore, the influence of stomach fluids, heart blood, and Minister fire give the tongue a normal pale red color. It follows, therefore, that a normal pale red tongue indicates a good state of the stomach, heart blood, and Minister fire, and therefore kidney yang. This tongue is almost normal in terms of body color and shape and coating. The only abnormality is a slight swelling. By pale is meant a tongue that is too pale, not a normal pale red tongue. The tongue may be pale either because not enough blood reaches it, or blood deficiency, or because a deficient yang fails to carry blood to it, yang deficiency. A deficiency of kidney yang also makes the tongue pale because not enough heat from the Minister fire reaches it. Therefore, a pale tongue indicates either blood deficiency or yang deficiency. The blood deficiency may involve the spleen, liver, or heart, or a combination of these organs. If there is liver blood deficiency, only the sides of the tongue may be pale. Other than that, one cannot pinpoint from the tongue only which organ is primarily affected by blood deficiency. A tongue will be pale when there is not enough blood circulating in it. This may be due to there being too little blood in the body in general, blood deficiency, and possibly Qi deficiency. there being too little qi or yang to transport blood up to the tongue, or there being something, cold for example, that is blocking blood from reaching the tongue. It is necessary to compare the color of the tongue with the shape of the tongue body, as well as the coating and the moistness of the tongue, in order to determine which pattern is involved. Blood deficiency will make the tongue not just pale, but also thin and dry. There is a rare situation in which yang deficiency can also result in a pale and dry tongue. This is when the yang is so weak that it is unable to transport fluids and blood up to the tongue, and therefore the tongue is dry. A yang deficiency tongue will not only be pale, but it will also be swollen and wet, as will a qi deficiency tongue. This means that you will have to compare the tongue with the patient's pulse and ask the patient relevant questions that can help to differentiate these patterns, such as whether they have an aversion to cold. If there is excess cold, the tongue can be pale with a thick, white, and wet coating. It is very common for the side of the tongue to be paler than the rest of the tongue. This is a manifestation of liver blood deficiency. The sides of the tongue can also have a pale orange hue when there is liver blood deficiency. Yang deficiency may involve especially the spleen and or kidneys. Again, one cannot pinpoint from the tongue which of these two organs is involved. However, we can say that in yang deficiency, the spleen is usually involved first, and kidney yang is involved in more chronic conditions. Therefore, we can deduce that there is kidney yang deficiency if the tongue is particularly pale. We can also deduce the same if the tongue is particularly wet. In a statistic from the practice of acupuncturists, 32% had a pale tongue. The tongue is never pale only on the tip. A blood deficiency tongue is slightly dry, slightly thin, and very common in women. Yang deficiency tongue, slightly wet, slightly swollen, and commonly seen in both men and women. Frequently pale on the sides when you have liver blood deficiency. Occasionally orangey in severe liver blood deficiency. By red is meant a tongue that is too red, not a normal pale red tongue. Obviously, red refers to the color of the body and not to that of the coating. A red tongue indicates pathological heat. The first question we need to ask ourselves when confronted with a red tongue is, does it have a coating or not? For a red tongue with coating indicates full heat, while a red tongue without coating indicates empty heat. It is important to understand that both full heat and empty heat are indeed heat, and they therefore each make the tongue too red. It is the lack of coating that indicates indeficiency, and for this reason, if a tongue is too red and lacks a coating, it indicates empty heat deriving from indeficiency. It should be stressed that a red tongue without a coating indicates specifically empty heat rather than yin deficiency, although obviously it arises from yin deficiency. In other words, it is the lack of coating that indicates the yin deficiency, and the redness without the coating that indicates empty heat. The implication of this, of course, is that there are many tongue types that indicate yin deficiency if the tongue body is not red. The tongue on the left is without coating, and the tongue on the right is red without coating. So a normal pale red tongue can become red or too red, leading to dark red. Red represents heat. Full heat is coating with root. Empty heat is no coating or coating without root. So here we have several examples of tongues that demonstrate full heat and empty heat. If the whole tongue is red, it indicates heat or empty heat, depending on whether it has a coating or not. When the whole tongue is equally red, we cannot actually pinpoint the location of the heat. Often, however, the tongue is either red only in a specific area, or although it is all red, it is redder in a specific area. 5 areas where the tongue is commonly either red on a normal tongue or redder on a red tongue: the center, the sides, the liver area, sides around the center, the stomach and spleen area, the tip, the heart area, and the front third, the lung area. Redder tip on the red tongue with coating is heart full heat. Redder tip on a red tongue without coating is heart empty heat. Redder sides on a red tongue with coating is liver full heat. Redder sides on a red tongue without coating is liver empty heat. Red sides around the center on the tongue with coating is stomach spleen full heat. Red sides around the center, more on the right, on the tongue without coating, stomach spleen empty heat. Redder front, the lung area on red tongue with coating is lung full heat. Redder front, the lung area on the red tongue without coating is lung empty heat. Red center on the tongue with coating is stomach heat. Red center on the tongue without coating is stomach empty heat. In exterior conditions with invasion of external wind, the tongue may not change much if the pathogenic factor is light. In some cases, the tongue coating may change. If the exterior wind is accompanied by heat, wind heat, the tongue body color may become red on the sides towards the front, the same area as the chest area. This change is more likely to occur in children. Thus, in the beginning stages of invasion of wind heat, the chest area may become slightly red. Indeed, this change is likely to occur in children even before some symptoms appear. When the redness spreads towards the center, it means that the pathogenic factor has become interior. Heat and fire are not the same. Although they both share similar characteristics, as they both pertain to heat in a general sense, they are not quite the same. The distinction between heat and fire is particularly important in herbal therapy, as they call for different treatment methods. Chinese books do not always use the terms heat and fire consistently. The confusion arises also because the term heat has 2 different meanings. In a broad sense, it indicates any syndrome characterized by heat, including fire. Thus, for example, liver fire is a heat pattern. In a narrow sense, heat is used as opposed to fire. This distinction between heat and fire stems from the Yang-Ming patterns of the 6 stages in the Shanghan loom. Within the Yang-Ming stage of the 6 stages, there are 2 patterns, channel syndrome and Fu syndrome. The channel syndrome is characterized by stomach heat with the 4 bigs: big sweating, big fever, big thirst, big pulse. The Fu syndrome is characterized by stomach fire, and its main manifestations are abdominal pain and constipation. These 2 symptoms indicate that the heat has penetrated deeper and has affected the Fu organs by drying up the fluids. It is now called fire. In Yang-Ming channel syndrome, there is heat, no dryness in the intestines, heat without form, manifested by high fever, intense thirst, profuse sweating, big or overflowing pulse. These are the 4 bigs. The tongue is red with yellow coating. Other symptoms: irritability, restlessness, breathlessness, red face, delirium. If heat is very intense and hidden in the interior so that it cannot flow outwards, there may be cold limbs. So this is what they call false cold through heat. Yang-Ming Fu syndrome is characterized by heat, dryness in intestines, heat with form, and this is more serious. Clinical manifestations: high fever, intense thirst, profuse sweating, abdominal fullness and pain, constipation, dry stools. The pulse is deep and full. Tongue is red with thick, dry, dark yellow, brown to black coating. Other symptoms: irritability, restlessness, breathlessness, red face, delirium, more likely than in channel syndrome. Especially in children, this pattern may lead to the development of interior wind, that is, going straight to the blood level with wind. So red body with thin yellow coating, it's heat. Redder body, thick, dry, dark yellow, brown, black coating is fire. In terms of the 4 levels, both heat and fire are at the Qi level within the 4 levels. Stomach heat pertains to heat, and intestines dry heat pertains to fire. Although the identification of patterns according to the 6 stages and the identification of patterns according to the 4 levels are separated by about 15 centuries, the Yang-Ming stage of the 6 levels is essentially the same as the Qi level in the 4 levels. More specifically, the Yang-Ming channel syndrome within the 6 stages is the same as the stomach heat pattern of the Qi level within the 4 levels. The Yang-Ming Fu syndrome within the 6 stages is the same as the intestines dry heat pattern within the Qi level of the 4 levels. Thus, within the Qi level, there are 2 energetic levels, that of heat and that of fire. That of heat being more superficial. Common manifestations for heat and fire: feeling of heat, thirst, red face, dark urine, rapid pulse, and red tongue with yellow coating. The tongue signs for heat are red tongue with yellow coating. Treatment principle: clear the heat with pungent cold herbs to push the heat onwards. Fire is more intense. There's pronounced feeling of heat, intense thirst. There is more drying, dark urine, dry stools, dry tongue. Fire affects the Shen more, so there would be agitation, mental restlessness, insomnia. This may cause bleeding, epistaxis, coughing up blood, vomiting blood, blood in the urine, or stools. Tongue signs: red tongue with thick, dry, yellow or brown or black coating. Treatment principle: drain the fire with bitter cold herbs which move downwards. Red points and spots are a pathological change of the normal red grains. The ancient Chinese called the fungiform papillae red grains. Red grains are a normal physiological structure of the tongue body. They are the individual papillae which form the body of the tongue. Red in red grains refers to a physiological red. Also, the red grains are flushed with the tongue surface and do not stick out. The physiological red grains are a manifestation of the physiological minister fire of the kidneys. Therefore, red grains indicate a physiological condition of normal heat deriving from the minister fire. When this becomes excessive, it flares upwards and makes the red grains redder and causes them to stick out of the tongue surface. When this happens, red grains are called red points or red spots. Ancient Chinese books on tongue diagnosis say that the physiological minister fire ascending to communicate with the heart forms red grains on the surface of the tongue, bearing in mind that the tongue is the offshoot of the heart. These red grains are normal and indicate that the physiological minister fire is in a healthy state. That is, it is neither excessive nor deficient. When the minister fire becomes pathological from various life influences, it flares upwards, causing the red grains to become redder and to protrude from the surface of the tongue so that they become more visible. When this happens, they are called red points. Red points, therefore, are always pathological. They indicate a pathological state of the minister fire flaring upwards. Red points always indicate heat to a degree greater than when the tongue is just red. The intensity of their color and their distribution clearly correlate with the intensity of the heat. The more intense the color and the more dense the distribution, the stronger the heat. Red spots look the same as red points, except that they are larger, and they are usually seen only on the root of the tongue. Like red points, red spots indicate heat, but with the additional component of some blood stasis. Red points are frequently seen on the tip, sides, center, or root of the tongue. Red points on the tip are relatively common, and they indicate heart fire, usually deriving from emotional stress. Red points on the sides in the liver area indicate liver fire. So red points on the tip indicate heart fire, usually deriving from emotional stress. We have red points or spots on the sides and root. Red points on the front, chest or breast area, and on the stomach, spleen area, worse on the right, and red spots on the root. Red points, breast area, left side, also some on the side, on the right. Then we have red points, lung area, and also spleen area, right side. Similar to red points and spots, white vesicles are also pathological fungiform papillae. These protrude from the tongue surface, but they are white rather than red. White vesicles indicate dampness. Thank you very much for your attention.